Hello everyone, you're watching sqadia.com and I am Hamad. Today our topic is complication of fractures. We will have 5 sections. In the first section, we'll be briefly discussing the general complications, what is the visceral and vascular injury, and what are the nerve injuries which may be associated with specific type of fracture, especially the hip, knee, elbow. What are the different nerves and vascular injuries which can be part of the associated injuries along with the fractures. In the second section, we'll be briefly dealing with one of the very lethal complications, if kept unchecked, can eventually lead to amputation. That includes compartment syndrome. What are its features, signs, or symptoms? How to diagnose the compartment syndrome, and what are the how to manage compartment syndrome, because it's one of the very emergencies in musculoskeletal system. In the third section, we'll briefly going through what is delayed union, non-union, and malunion. As you know that any fracture can result in a delayed union or a non-union as well, or even there could be a malunion. There could be post-union angulation which has to be dealt with as well. And also it's also a part of the general complications of the fracture. We will be specifically dealing with that in this section. In the last, we'll be going through the late complications, especially associated with certain problems such as avascular necrosis of the certain bones, such as head of the femur, talus, scaphoid, all this, because they may be very late, but they may be a very pertinent and problematic complications, especially if it's a scaphoid non-union advanced collapse, or if it's a non-union of the talus, which can be very problematic with the patient to use his or her wrist or even to walk on his ankle. Then in the last section, we'll be going through the joint disorders, which may also be directly or indirectly associated with post-traumatic arthritis. We'll be discussing joint instability and joint stiffness, osteoarthritis, and lastly, complex regional pain syndrome, which is also called as reflex sympathetic dystrophy as well. And this is one of the very common causes of continuous pain and problems, especially associated with the conservative management of the fractures. Keep watching sqadia.com. Thank you very much.